My name is Gregory Busse. I'm the Director and Medical Lead for CNS in Medical Affairs here at Azurity. I have a doctorate in psychology. I've specialized in psychopharmacology and behavioral neuroscience, and I've been around the block. I've been in academia, FDA, and now roles in industry. So let's start with what the indications for Arynta are. So Arynta is lisdexamfetamine ready-to-use oral solution. The indications are for ADHD in adult patients and children 6 years and older. We also have an indication for moderate to severe binge eating disorder. In the context of formulation development, I think there's some very broad themes in psychiatry that should be kept in mind that's agnostic of the patient's diagnosis. Number one, the drug matters. So just like stimulants, not all psychotropics are, even in the same class, are equal, right? This happens in ADHD, this happens in mood disorders, this happens in psychotic disorders, etc. So tweaking formulations, for example, we use the example of immediate release to extended release. You can have several advantages. So the first one is you can actually extend your therapeutic coverage, right? So you can go from 4 to 8 hours. You can go from 8 to 24 hours. You can go from 24 hours to weeks and beyond, like, for example, in the case of long-acting injectables. You can also have pharmacokinetic benefits, right? So formulations that move towards more extended release profiles smooth out the peaks and troughs of the pharmacokinetic profile. So you can stay within the therapeutic window longer. You can remove those high peaks, which often translate into adverse events, or you can remove those low troughs, which often translates into loss of efficacy. So these are very important advantages in formulation development. In addition, you can also have some adherent benefits. So the less times during the course of the day you have to take the drug or you have to remember to take the medicine, the better the adherence. So you have less missed doses, you have more forgiving. It's more forgiving if you miss a dose. You have better outcomes. There are better prognoses and health economic benefits. So the closer a formulation is to patient preference, the therapeutic goals, the acceptable AE profile, the less a physician would actually have to switch the medication. So in the context of prognosis, the longer you go without treatment for a psychiatric disorder, we also know that the prognosis is actually worse. Secondly, excuse me for a second. Secondly, it helps reduce the economic burden of having to actually switch a medication and hospitalizations and behaviors that induce additional harm, so risk-taking behaviors, substance use, driving fast, getting into fights. So these are all tangible benefits for formulation development. And what about liquid formulation? So as I noted earlier, if a patient is averse to taking pills or maybe just prefers a liquid, the availability of a liquid formulation is what the patient may need to have effective treatment that they deserve. I think the most important thing is that physicians, clinicians, they need to remember to ask questions of their patients when they're prescribing a drug like Lisdex or any medication for that matter. We need to ask what the patient's medication preferences are. We need to ask what their treatment goals are. We need to take these considerations into account when choosing from the menu of drugs that are available. It just may make the difference for treatment success. So with any drug, clinicians should also always weigh the benefits against the safety issues. So consult the label. Although stimulants have tremendous efficacy, their effect sizes are impressive, they still carry risks. So as I noted earlier, is that Lisdex is a Schedule II stimulant product, and it has a boxed warning for abuse, misuse, addiction. This is a class box warning that actually goes across all the stimulants used for ADHD. And in fact, in 2023, FDA released a drug safety communication that improved the consistency of the language across these different drugs in the boxed warning and warns of risks of diversion. So clinicians should always consult a label. They should talk with their patients, counsel them about these risks, and weigh them against the benefits that treatment may actually provide. And so with that said, I would just like to say, choices, options matter. It's important for physicians to always talk with their patients, know their preferences, because these patients deserve options as well.